Let me know when you see I hit start recording. So, there we go.
Okay, there it is. So per Governor Lamont's executive order regarding public meetings, and I believe which will be in place until the public health emergency is over, we are continuing to record these meetings and then post them on the Office of Policy and Management website. So to save a little bit of time, we won't go around and do introductions, but when folks speak, if you can just say who you are and what agency you're with, because Connecticut Network can't cover this live, but they are going to attach to our link after this. So this will be on Connecticut Network at some point on demand. So the first thing we wanted to do, we're very happy that we have Mairead Painter, Connecticut's long-term care ombudsman, with us. And I know Mairead has to duck out at 10:30 for another event. But Mairead has graciously agreed to give us an update on legislation that was passed this session, the regular session, related to long-term care facilities, because as everyone can imagine, that issue is certainly front and center due to the pandemic. Most of you probably know the Senate is in special session today and the House is in special session tomorrow, and they will be taking up the budget implementer bill. And so there may be some other long-term care related issues that get addressed in that. And with that, I'll turn it over to Mairead. Mairead, you have the floor.
Good morning, and thank you, David. Thank you, Melissa, for putting things together. It's nice to see everybody. I feel like I was seeing everybody regularly, and then we had a couple week hiatus. So I think everybody hopefully had an opportunity to recharge. And as David explained, the regular session is over, and it began on January 6th. It was interesting that after such a stressful year and the year before not really having the ability to complete session, this session began just weeks after our long-term care residents received their first vaccines. And so it kind of, I think, gave a new light to people, as well as the fact that we had something called NAWLOG, which was the Nursing Home and Assisted Living Oversight Work Group, that came out of the Mathematica report, was developed with stakeholders, people from the state agencies, elected officials, working together to find ways to move forward with some real meaningful legislation that was going to help impact our long-term care communities. We also worked with our executive board of presidents of resident council and family members to make sure that they were active participants in legislative session. I did find out that that was unique to Connecticut. Not a lot of other states did that or took it as seriously as our elected officials did, which I was incredibly impressed by. So some of the key nursing home measures that passed include the right to the use of technology of a resident's choice, including video cameras with appropriate safeguard and protections and access rights. So I see Representative Q on here, and I want to give a special thank you to him and Senator Miller for their incredible work that went into getting this bill passed and across the finish line, and sort of the back and forth that happens with bills, but that they kept the residents at the forefront of a lot of the decision making and legislative actions this session. So thank you, Q. The camera bill was something we had worked on for a long period of time. Many years previously, but were never able to get it passed. We worked with the union and the associations to make sure that it is well balanced, protects all of the residents, but really ensures that residents get to treat their rooms like their own private home space. We also saw legislation pass that requires that residents and family councils get notified on regular legislative proposals that impact long-term care facilities, and that they have the right to testify remotely or as needed to meet accommodations. I'm not sure if people realize how huge that is and what groundbreaking legislation that is across our country. We often pay for residents to go from long-term care communities to the LOB to testify, but I can only pay for a couple residents a year. when there are 18,000 residents that live in long-term care communities. So it doesn't work well. Having this ability to have accommodations made in order for them to be heard is incredibly important and will be very meaningful. We had a lot of testimony that residents either did remotely, recorded and submitted, or joined live and actually testified for the first time this year. There were also improvements to the DPH minimum staffing requirements. We had aimed for a 4.1. We got 3.0, which is fabulous. That is a huge increase from the 9.1 hours a day of hands-on care that we've historically had. And I think that after what we saw this year and the feedback from residents and family members and staff alike, that this was something that was needed, and we were happy to see that that passed. Also, the ability for residents to have a higher personal needs allowance. Again, something that we've been working on for years, and we finally got it across the finish line this year. I want to also add that Nancy Schaefer says, thank you very much. I did. She was my predecessor, and these are things that she also has advocated for years and was happy to hear that they passed. There was a lot of effort put into what happens in a nursing home infection control wise, PPE, and making sure that individuals living in long-term care communities have access to IVs, staff, education, and that their lives are meaningful, well-directed, and that they have a high quality of life. Support for this and promoting family councils was something that the elected official took very seriously, continued to move forward, and we also saw support from all of our state agencies. Many of these bills some are effective immediately, many are effective on October 1st, so we have a lot of work to do between now and then to make sure that we have all of the appropriate mechanisms in place to move them forward. From the residents and family councils, one of the bills that they thought was incredibly important and did pass was essential support persons, which will allow an individual to have access to at least 2 people here in our state, even when there's visitation restrictions in place. I will let you know that I'm pretty actively working with some congresswomen and congressmen nationally to have a federal essential caregivers bill put in place that would also help provide these protections that would balance out a lot of what Connecticut put in place here. So Connecticut did it. We're working with Congressman Larson's office right now. He's a co-supporter of the bill, as well as NASOP, my national organization. Strengthening the Bill of Residents' Rights that was related to technology and access to internet. I think before the pandemic, many of us took for granted how easy it is for us to get on the internet and talk to loved ones, use FaceTime, have access to our phones. I'm kind of shadowed here. But for residents, that was a lifeline for them. That kept them connected to the important people in their lives. And we saw how some buildings, because of how they're set up and the concrete and the multiple floors, they weren't able to have those meaningful connections. And we saw many individuals that suffered from failure to thrive and being disconnected and isolated in their rooms for almost a year. This was not the fault of the industry, I don't believe. We can't just say the industry should have done more. We did not have appropriate mechanisms in place to help safeguard people from this and to support them to be connected, whether it be remotely or using all kinds of technology. I also learned that Echo Dots and those types of things, family members can talk through. You can watch a TV show together and play Jeopardy. You can use them in all kinds of ways to have the news read, to know what's going on with current events. So my office is committed to making sure that residents are fully informed and have access to that information. Also access to information from my office, just to keep you updated on what we're doing. I did the Facebook Lives over the summer or over the year, and what we found is not all residents have access to Facebook. That is much more affordable for them to have one of those little mechanisms to listen to. So starting in the end of July, beginning of August, we will be going to a podcast series called Your Care, Your Rights, Your Voice, and connecting residents directly where they can ask in their room for a podcast on any of their rights to get it more information. They won't have to call our office. It'll be on demand right through those services. So we're going to be messaging that and getting that out. I'm a little afraid of doing this because I have not done podcasts before. We're gonna work on it. If anyone wants to sign up to join me and be a part of that, please let me know. We want to make sure we have a lot of diverse topics and information out there for people to serve. So there were tons and tons of bills. I really encourage you to go through and look at what passed this year related to long-term care. I could probably talk to you all for another hour. I want to thank all of you for the support and the work that you did in order to make sure that residents, older adults in our communities, individuals facing disabilities, and our long-term care residents had the support that they've needed. I see Mike on here from housing, you know, Christy, everyone works so hard. Our access agencies, holy cow, the work that they did. So, and the support that we've had from our agency and the State Unit on Aging, really everyone coming together in Connecticut was a model we did not see in other states. And you guys should be really proud of the partnerships and the long-term care continuum that we've built. But the one thing I'm going to ask, and I know everybody's tired, is you can't lose that passion now, because we've seen what can happen when people give it their all and the outcomes that we can get. And we really need to keep that going. So take a breath, take a vacation, take some time this summer, and let's come back and continue the work next year. So thanks, everybody.
All right, thank you. And on behalf of the Long-Term Care Planning Committee, I want to thank you specifically and your colleagues for the tremendous work you did during unprecedented difficult times, and the initiatives that you were able to shepherd through the legislature this year. Before Mairead has to go, does anybody have any questions for Mairead? Okay. I don't see any. So at this point, I'm going to turn it over to Melissa Morton from the Office of Policy and Management, who's going to give us a quick update on some other pieces of legislation that passed during this session that Mairead did not touch on. So Melissa?
Thanks, David. Good morning, everybody. Marie did an excellent job covering the pieces of legislation that pertain to long-term care facilities and nursing homes. So I am going to give a rundown of just a couple of the pieces of legislation that passed this session that are pertinent to long-term services and supports. This is not going to be a comprehensive overview of everything related to long-term services and supports. We are working on putting together our annual long-term services and supports legislative update. That will be coming out after the implementer is passed, and we get a chance to go through that and see what is in there that might also merit being included in our annual report. So once we have that done, that will get distributed to everybody on the mailing list. So you can look forward to that. In the meantime, here are just a couple pieces of legislation I want to highlight for you. I'm going to go quickly, but again, you'll get it in writing later. So Special Act 2110, an act concerning a workforce development pipeline for persons with disabilities. So this bill requires that the Department of Economic and Community Development incorporate into their state workforce strategy the establishment of a workforce development pipeline program for persons with disabilities. And this plan, it should be designed to incentivize businesses to provide training programs, offer modified interviews, and to reserve full-time jobs for persons with disabilities that should be paid at the full market rate. This plan needs to be developed by November 1st of 2021, and it needs to plan for and include a path to implementation by July 1st of 2022. The other bill I want to highlight is HB 6458. This is an act lowering the age of eligibility for property tax relief for senior citizens and establishing a task force to protect senior citizens from fraud. So essentially what this bill does is expand eligibility for the elderly tax freeze program by decreasing the program's minimum age, which is currently 70, down to age 65. The bill does allow for municipalities to have some flexibility here. Whatever the municipal legislative body is that comes together and votes is allowed to vote to have an age over 65 to be the minimum qualifying age if they so choose. Municipalities that have already voted to limit program eligibility to individuals age 70 and older prior to this date are grandfathered in, so they don't need to take another vote unless they have now changed their mind and want to expand eligibility to an age below age 70. Under the program, towns may freeze the property taxes on a home whose owner occupant or his or her spouse meets the minimum age requirement and has been a state resident for at least 1 year. The freeze continues also for a surviving spouse who is at least age 62 when the homeowner dies. And again, homeowners must also meet the state circuit breaker program income limits. And towns also have the option of imposing asset limits for eligibility and retain the ability to place a lien on properties. Another thing that this bill does is that it establishes a 10-member task force in order to study ways to protect seniors from fraud. And that task force needs to complete its work and provide findings and recommendations to the Aging and Human Services Committees by January 1st of 2022. And like with most of these types of committees, it disbands as soon as the report is submitted. There are two pieces of legislation I want to highlight related to telehealth that passed this session. The first is Public Act 21-9. This bill modifies requirements for the delivery of telehealth services and also addresses insurance coverage for these services through June 30th of 2023. This bill is large. It does a number of things. A couple of the things it does that I want to highlight for this group is that it expands the types of health providers that are authorized to provide telehealth services. It allows certain telehealth providers to provide services using audio only, which current law prohibits. And it allows telehealth providers also to use certain other types of information and communication technologies, such as FaceTime. And it establishes the requirements for telehealth providers who are seeking payment. They're not allowed to deny payment for an in-network provider who's providing telehealth services, and it also can't reduce the amount of reimbursement that they provide to a provider because the service was provided through telehealth instead of in person. And it also prohibits providers from billing patients beyond acceptable cost sharing. The second telehealth bill is HB 6470, and that's an act concerning home health, telehealth, and utilization review. And this bill seeks to increase healthcare access by making some of the telehealth changes we saw during the public health emergency become permanent through the medical assistance program. So it's taking a lot of some of the executive order changes that we saw in permissibility around telehealth and making them permanent for our public program. Specifically, this bill eliminates the original sunset date of June 23rd, 2021, and now allows the DSS commissioner to permanently implement telehealth when she determines that doing so is clinically appropriate, allows for some flexibility in what type of audio-visual telehealth services can be provided, allows her to make it permissible to let people use audio only services when another type of equipment is not accessible. And the bill also expands the type of healthcare provider who can order home health care services by allowing APRNs and physician assistants to now have the ability to order home health care services, and allows DSS to waive or suspend prior authorization requirements and other utilization review criteria and procedures for Medicaid and the Children's Health Insurance Assistance Program. So those are some of the major changes that are going to that are now permissible because of HB 6470 with telehealth. We also have HB 6637, an act concerning the Mental Health Bill of Rights for deaf, deafblind, and hard of hearing. This bill establishes a Bill of Rights for individuals who are in need of mental health services, who are deaf, deafblind, or hard of hearing. It, within its text, specifies that the rights afforded to these individuals must be available to them, but says that must be available to them as afforded to them under general statutes, federal law, and in line with the general U.S. Constitution. The bill actually goes forward and changes the name of the advisory board for persons who are deaf and hard of hearing to the advisory board for persons who are deaf, hard of hearing, or deaf-blind. And it makes several minor changes in the statutes around the governing of this board. Most notably, what it does is allow more flexibility around board members and board representation by eliminating some of the requirements about who can serve on the board. SB 763 is an act requiring drivers of paratransit vehicles to report suspected abuse, neglect, exploitation, or abandonment of elderly persons. So this bill just adds paratransit vehicle drivers to the list of mandated reporters who must report to DSS when they have reasonable cause to suspect that an elderly person is in need of some sort of protective services because there are signs of abuse, neglect, or exploitation, or the individual has been abandoned. The bill goes on to define exactly what type of vehicle falls under the definition of paratransit as well. SB 955 is an act concerning revisions to obsolete provisions of the general statutes affecting the Department of Social Services. This is a large bill that makes several revisions to statutes that affect DSS. The change most relevant to the Long-Term Care Planning Committee is that the bill limits participation in the Connecticut Home Care Program for persons with disabilities to those individuals who are ineligible for Medicaid or Medicaid waivers. SB 1070 is an act allowing advanced practice registered nurses and physician assistants to issue home health orders. So this bill allows PAs to certify, sign, or otherwise document medical information in several situations that would currently otherwise require physician or APRN signature certification or documentation. So among the items that this bill now allows a PA to do is to certify a patient's health condition or related information for the purposes of insurance coverage, which would also include coverage under the Connecticut Home Care Program for elders. And it allows certifying for disability and illness, for continuing education waivers and other health professions. And another notable thing for our group is that it now allows PAs to document that a patient's room transfer in a nursing home would be medically contraindicated. the bill goes on to extend certain other provisions to PAs as well. Now, what the bill does not do is it still requires that anything that the PA does be done under the direct supervision of a physician who is then actually the entity who is solely responsible for the patient's health outcomes. Then Public Act 21-26, an act concerning various revisions to the public health statutes. Again, this bill makes numerous changes to public health statutes, but of particular relevance to long-term services and supports is Section 4 of this bill, which requires hospital personnel, when admitting a patient, to promptly ask the patient if he or she wants the hospital to notify a family member, caregiver, or support person of their admission. If the patient chooses to have this notification done, hospital personnel must make reasonable efforts to contact the family member, caregiver, or support person as soon as practicable, but within 24 hours of the patient request. So those are the bills of note right now. And as I said, there are more bills included in the legislative update and more to come as we learn what ends up being included in the implementer.
Great. Thanks a lot, Melissa. Thank you for that excellent update. And I also wanted to thank Maria again for her update before she has to jump off. Does anybody have any questions for Melissa at this point?
David, I am going to jump off. Can I just make an announcement about where I'm going?
Yeah, sure.
Oh, sorry, I just wanted to let people know today is World Elder Abuse Awareness Day, and the Lieutenant Governor is having a press conference this morning. So if people have an opportunity, reach out to your neighbors, other older adults in your community, check on them and continue to do that. But there's a lot of information out there about world elder abuse, and thanks for all your support. See you guys later.
Thanks, Marie. I just briefly wanted to touch on a bill that passed related to long-term care insurance, and it was the only bill that was passed related to long-term care insurance. That was SB 1046, and that concerning long-term care insurance. The major provision in that bill is a prohibition on what we refer to as the stacking of premium rate increases. Many of you may know that with long-term care insurance, insurance companies do have the right to request that premiums for their policies be increased, but that request has to be reviewed and approved by the Connecticut Insurance Department. If the insurance department approves a rate increase of 20% or more, the insurance company has to implement that over a 3-year period. And that was a piece of legislation that we had actually advocated for and got passed several years ago to help minimize the impact of a rate increase in any given year. It does not cap the total amount of the increase, but it spreads that out over 3 years. However, there was a loophole in that legislation, and that is that during that 3-year period, while an insurance company was implementing a rate increase, they could request another rate increase for that same policy. And the insurance department, if they approve that, then would allow the insurance company to stack the second rate increase on top of the first rate increase, which would create a significant burden and hardship on policyholders. So what SB 1046 does is it prohibits an insurance company from requesting another rate increase for the same policy while it's implementing a previously approved rate increase over that 3-year period. And our hope is that will reduce the burden on individual policyholders. I also want to make mention of a couple of bills that passed out of committees, but never actually came up for a vote in the full legislature. Just about every year for the last 10 years, the Aging Committee has passed out a bill that would provide a tax deduction for long-term care insurance policies that certainly would help to make them more affordable and create an incentive for people to purchase policies. However, for the first time, the Finance Committee, which ultimately is the committee that would have to act on any sort of tax-related legislation, even if it came from another committee, the Finance Committee actually passed out a bill unanimously that would have provided a 20% tax credit for long-term care insurance premiums. It would have been quite generous, but that bill never came up for a vote. It was a House bill, never came up for a vote in the House. But personally, having worked in long-term care insurance for now 30 years, it was encouraging to see movement in trying to make policies more affordable for Connecticut residents. But the provision in Senate Bill 1046 that prohibits the stacking of rate increases is a good step forward to help mitigate the burden on policyholders going forward. Anybody have any questions on that? Okay. Does anybody have any other pieces of legislation that either Murray, Melissa, or myself missed that you want to touch on? I know we're honored to have Representative Phipps, the co-chair of the Aging Committee, with us. I don't know. I don't mean to put him on the spot, but if there was any legislation that he wanted to highlight from this session, we'd be glad to hear about it.
No, actually, I mean, I don't have anything to add. Matter of fact, if there's any place that you have all that compiled, if you can send it over to me so I can remember all these awesome things that we've done, that would be super helpful. Though I'm
not seeing
kind of
any hands or
but you
anybody
can hear me,
speaking.
can
Are you there, Representative Phipps?
Oh wait, can you hear me?
Yeah, we can hear you now.
Okay, now you can hear me. You couldn't hear me before. No, I was just going to say thank you for everyone's hard work in this endeavor, and particularly in my first year as a chair of the Aging Committee. And I was going to say, if you have all the things that you've already compiled about all the things that we've done this year, so if you could send it over so we could have a reminder, that would be actually super helpful. I'm kind of jesting about that. Actually, no, completely joking. But no, I really do think that we're able to get a lot done.
What we'll be putting together once the special session is over and we know what's in the budget implementers and we know all the bills that the governor signed, every year we put together a pretty comprehensive legislative update, thanks to Melissa Morton's hard work. And then we'll share that with all the committee members.
Oh yeah, no, I was just going to just finish and say that I do think the reason that we were able to get as much as we got done was because of the intellectual capital that is in this very group. And I said we could not have done it without you all. And could not have done it, in particularly in this sort of bipartisan manner. So I also want to give a shout out to our ranking member, Representative Wilson, for just being a really collaborative partner. I think a lot of our work, particularly around the camera bill, which I know was a top priority to making sure that we had connections back and forth in the centers and outside. I was told from the very beginning that we would never be able to get it done. And not only did we get it done, we got it done unanimously, which is that they said it would never happen in a million years, and it was done this year. So something I'm really proud of, and just wanted to thank you all for your work in helping make sure we got it across the finish line.
You just muted yourself, Representative Phipps.
No, that was all. That was all I had to share. And what I will
Oh.
do is, matter of fact, what I will do is add my cell phone number in. So this way, if anyone does need help in the future, things that we should be working on. I see Christy Colville said not only a good friend, but also a constituent, and it's a great champion in this work. I know there were some things that we missed, in particular that respite bill, which was getting shame on me for not recognizing, I think, a lot of the power that we had in this particular session. And I think the financial picture of our state looked very different at the beginning when that was proposed versus at the end. So it is going to be a top priority both next year and moving forward. So if there's any of those other things, and I will say that we did a intentional and strategic decision from the very beginning of looking at the bills that had either low cost or no cost fiscal notes in the aging committee, because the committee traditionally hasn't got a lot of bills across the finish line. So we wanted to make sure that we did things in a financially expedient manner, and next year really showing that our senior community deserves to be invested in the same way all the other constituencies are. So that respite bill is in the top and forefront of our minds. And I think we also mentioned some of the other things, but like the long-term insurance care and so on and so forth. So let's work throughout this summer to make sure that we have a quick start in February of next year.
Okay. Thank you very much for that.
And that's
So
my personal cell phone number.
Okay. So if there are no other comments on legislation, there's really nothing new relative to the long-term care plan that we need to develop this year for submission to the legislature in January. Last meeting, we had given you an outline of the timeline for the development of the plan, and we really don't start work in earnest until July, when we will start soliciting input from planning committee and advisory council members. So nothing's really changed in that, and stay tuned. More to come on that. So at this point, are there any members who have any announcements they want to make, or updates, or grant awards, or anything you want to share with the planning committee?
David, can I jump in? This is Marky. Is that okay if I jump in?
Yeah, go ahead.
Okay, thank you. So Margie Gerando Marquette from the State Union on Aging of the Aging and Disability Services. And I know Mairead had to hop off, but a big thank you to Mairead and her amazing team for the incredible work that they've been doing the past 15 months, especially. So I just wanted to share that the State Union on Aging has received some vaccine funds, as well as some funds from the American Rescue Plan. And we received 2 vaccine grants to expand access to COVID-19 vaccines. And with these funds, our Area Agency on Aging partners and our Centers for Independent Living partners can assist in providing information, answering questions, helping schedule a vaccine if needed, arrange or provide transportation to vaccine sites. The grant has some flexibility in there, so we're looking to see what everyone can do to help, because while so many people are vaccinated, there is still work that can be done here. So we're grateful to have some funds to be able to do that. The American Rescue Plan funds that we received will be allocated to the area agencies on aging. And the purpose of these funds is for prevention and mitigation activities related to COVID-19. One area of focus of these funds is addressing extended social isolation among older individuals. I know that's been a theme throughout COVID. I know Mairead had mentioned the work that they've been doing around that as well in nursing homes. It's also a concern in the community. So there's a way for us to use some of these funds to address that, as well as some technology issues and so many other things as well. And I know Marie did mention that today is World Elder Abuse Awareness Day. And Mairead, as a co-chair of the Coalition for Elder Justice, along with our new staff attorney at the State Unit on Aging, Laura Stowning, are joining the Lieutenant Governor at a press conference. I did want to mention that the Coalition for Elder Justice is hosting an Elder Justice Symposium next week on the 22nd. It's called Advocating Through Adversity, Celebrating Success in These Challenging Times. And I'll just give you the website as well if you wanted more information. They're doing some really great work. elderjusticect.org if you wanted to take a look at that and follow them. So thank you for the opportunity to provide an update.
Thanks,
Hey,
Margie.
Margie, are you done? I apologize. Teams is not working very well for me, so it's very hard for me to hear. Anybody else have any other announcements? Okay, does the Long-Term Care Advisory Council have any comments they want to make at this point?
David, I can speak for a moment on that. Good morning, everyone. Just want to let you know that I think we are looking at June 29th to reconvene the Long-Term Care Advisory Council. I have been in touch with Steve Hernandez on reconvening this group. So there will be more information to come. We're looking at a morning time. I'm going to have the commission organize the technology for this, but we'll be back in touch with that. But great updates today. Thank you to everybody for your support. Representative Phipps, thank you for your leadership. These updates were tremendous, and I think we've made some good work in the space this year.
Right, thank you, Christy. And we are really looking forward to the Advisory Council getting back up and running, given that this is the year that we'll be putting together our next 3-year plan. And we really can't do it without the Advisory Council and your input. So I think this is good timing relative to that. So anything we can do to help in that, just let us know.
Thank you.
Thanks. So with that, I think we've run through our agenda. Does anybody have any last comments or questions? Okay, I don't see any, but again, my Teams isn't working. Melissa, do you want to give me a thumbs up if there's nothing?
There are no questions.
Okay, thank you. Again, I want to thank everybody for joining us today for our Long-Term Care Planning Committee. And our
Motion to adjourn.
Okay, we have a motion to adjourn. Do we have a second?
Second.
A second from Margie. We are now adjourned. We will meet again on September 14th, but we will be in touch before then with our legislative update and long-term care plan updates. So thanks, everybody. Have a great day. Bye-bye.
Bye-bye.
Thank you.